Hey everybody, Dr. Mark Sutor. Just wanted to tell you that we're going to talk about a really interesting topic tonight called sedation dentistry, oral sedation. First of all, my Hoosiers, if they could only play half of a game, we would be pretty good. We can't seem to win in the second half. So anyway, this guy's kind of tear my heart out, but I thought we were going to beat Michigan State. So tonight, I want to talk a little bit about what's the difference between IV sedation and oral sedation. Have any of you heard about, like on the radio or any kind of advertisement about oral sedation or sedation dentistry? There's been kind of a push in dentistry where people can take some pills, pretty much sedate themselves or be sedated so that they can have like a lot of dentistry done. And it's kind of like having an IV, and I'll explain to you what I think is a much better alternative to an IV. So first of all, when I was at Kentucky, yeah, I have a Kentucky degree of all things, I was doing my residency in Lexington, and I was trying to figure out what I could do for my master's thesis. And I wanted to do something that I could use as a practitioner. So I asked my chairman at the time what would be a good idea in something that hasn't been studied very often, but something I could maybe possibly do. So I hooked up with an anesthesiologist. He was actually an anesthesiologist and a dentist. How often do you see that combination? So Dr. Dembo was brilliant, and he came up to me and said, "Hey Mark, we should study the benefit of Halcyon, or what a drug called triazolam, and how that could be used in dentistry." And then he went on to tell me that at the time, this was in 1989, at the time, there were 4 studies on oral sedation in dentistry, and most of them were in the UK. So I quickly found out this could be really cool. So what I did is I developed a study in which I used a certain level of this Halcyon medicine, and I gave it to a variety of patients. And I didn't know what the medicine, how much of the medicine they were taking. They were either getting a sugar pill, they were getting about 1/4 milligram or 1/2 milligram, and then I tested a variety of things. Like, what did it do to their heart rate? How sleepy were they? How much amnesia did they have? And I want to talk about the benefit of that. And how relaxed were they? Like, what was their anxiety level? So one of the cool things I found out, and one of the funny things about doing this testing, is I would show people, I'm going to show you these pictures. So I would show them common pictures before, during, and after their surgery, right? And the idea is that if you show somebody common pictures that a 3rd grader could recognize, it takes all the bias, takes like all the educational bias out of your study. So I would show them a picture of a bird or shoe, and I would show them about 5 pictures before they took the medicine, during their surgery, which is about an hour after they took the medicine, and then after the surgery. And then I would call them that night, and I would ask them about their experience, their anxiety level, and what kind of pictures they remembered. And the interesting thing about this was when they just took a 1/2 milligram of Halcyon, they had about a 60-70% amnesia relationship. Meaning, when I asked them about those pictures, 6 out of 7 out of 10 people didn't even remember me showing them the pictures. So I started thinking, man, this could be a really cool way for me to do surgery on patients without the risk of giving them an IV, without the cost of an IV, and I'll talk about that, and a really safe way to be able to give people the anxiety reduction that a lot of people look for in dentistry. How many of y'all have either been anxious about dentistry, know people that are anxious about dentistry, or quite frankly don't see the dentist because they're scared to go into the dentist? In today's world, you really don't have to do that. You know, you really don't have to use the excuse of, man, I'm so afraid to go to the dentist and that's why my teeth are in bad shape. Because this kind of medicine is an awesome alternative. So how many of you know what Valium is? So a lot of people take Valium for anxiety, for sleep, things like that. So think about Halcyon is literally 10 times more potent than Valium. So a good example would be if you took if you took a kind of 10 milligrams of Valium, you only have to take a 1/2 milligram of Halcyon and actually get a better anxiety reduction. It'll decrease your heart rate. So if you have heart disease, you know those 2 numbers, there's a top number and a lower number. That lower number gets reduced by about 10 points. So if you had hypertension or heart conditions and you took this medicine, it actually decreases your heart hypertension in a significant way. So what I've done for people since I moved to Bloomington in 1991 is I've given them 2 little tablets called Halcyon, about 1/2 milligram, and they would take it an hour to an hour and a half before their surgery. And I have done tens of thousands of surgeries on people over the 25, 26 years I've been in practice. And I have really had about 2 people, I bet, in that whole time that literally wanted to have an IV instead of oral sedation. And my kind of learning aspect of that is you can take an oral medicine, which is typically, this type of drug has a huge therapeutic range, meaning that if you take this medicine, it has an enormous range at which you would not have complications. Some medicines have a really narrow range where if you take it, there's kind of a peak where you can have some trouble. So Halcyon works effectively in the first hour. It lasts for 5 hours. And when you go to the bathroom the first time, you eliminate about 90% of it when you go to the restroom. So this medicine doesn't stick around your system. Did you realize when you take Valium, Valium breaks down into 2 other drugs that stay in your system up to 3 days. So when you take 1 Valium, you're basically sedating yourself for 3 days. A lot of people don't know that. So if you're driving and you took Valium yesterday and you're driving today, you statistically are kind of impaired because that medicine has not been metabolized through your system, and it's a problem. Some people have actually gotten legal problems because they were on that drug, got in accidents or something really bad, and they found out they still had that medicine in their system. So Halcyon does not do that. It's called a short-acting benzodiazepine, meaning only lasts for a very short period of time, 1 to 5 hours, and it's excreted with no metabolites, meaning you don't have a bunch of this drug hanging around your body, which is super important in today's world. So my argument would be, why pay to have, most IVs that I've noticed are $600, $700, $900 for an IV. Some IV surgeries are 20 minutes, 30 minutes. We charge people a couple $100 for an oral sedation, monitor our patients very, very well during their procedure, are completely comfortable. Most of the people don't even remember what I did. And it's a lot less, it's more cost effective, it's less expensive. I would argue it's safer. Some people that do IV say, no, that's not true. If I have an IV, I can push these drugs right through your veins, and if something happens to you, I can do something online. And I have a hard time with that argument because I've done this long enough that in the types of surgeries that I do, even I've done lots of third molar extractions, not the most complicated ones, but moderate to mild kind of extractions. You can take this medicine. I've done implant surgeries for people. You can take this medicine safely, inexpensively, and with a really good anxiety reduction. So when you hear about the term conscious sedation, these are all terms that you'll hear. Conscious sedation, sedation dentistry, oral sedation, those are all terms for when you take a pill and your anxiety level goes down, your brain kind of function decreases, because when you take any kind of drug like that, a lot of people take it for sleep. Remember Burt Reynolds? Burt Reynolds got addicted to Halcyon, and early on people kind of had a negative connotation with Halcyon because he was taking 5 milligrams a night to sleep. So I can't imagine giving my patient 10 times the Halcyon medicine I give him. I can't imagine how Burt Reynolds even functioned. But what happens is when you take medicine, your body adapts to it. So the less medicine you take, the better. So you can take 1/2 milligram of this medication and be as effective or more than 10 times the medicine of Valium, which is a very common sedative. So the medicine's called Halcyon. Triazolam is the technical term. The class of drugs for people that are into that are called benzodiazepines. They're basically medicines that people take for insomnia, for anxiety, people that have a lot of anxiety and stress in their lives. Sometimes people will prescribe that. I think it's a great medicine for dentistry, and it's a phenomenal little window of treatment that you can take. You can decrease your anxiousness, your anxiety, your fear. You can have dentistry done in a really sedated, nice, comfortable way. I had a patient today that honestly snored through the procedure because she was so sleepy. So I think that when you get to that level, people really, when I call her tonight about her surgery, she won't remember anything about her treatment. So anyway, I wanted to share that with you. I think it's a wonderful way to have really good dentistry done if you have anxiety or just have had bad dental experiences. I've had tons of people that started out on that medicine, and then by the time I've treated them over years, they don't take it at all anymore. So Halcyon is a great way to decrease your dental fears, be able to have your dentist help you do the dentistry that you need, and be able to have a healthy mouth for a lifetime. So I hope that was helpful. If you have any questions, please either share this with your friends, send me some questions about it, and I will see you all. I probably won't see you next week. I've got a dental conference, but I'll probably see you in a couple weeks. So have a good night, and cheer our Hoosiers to see if we can beat Maryland on Saturday. Good night, everybody.